So I'm going to check my physician's orders, check my MAR up against, my MAR up against my physician's orders. And I see here, I'm looking at, I have furosemide, 40 milligrams, IV piggyback every 8 hours, okay? And I'm looking at that it's the right time, the right dose, and the right route, okay? And I'm also making sure I have the right patient. I'm looking for any allergies, and I see that my patient doesn't have any allergies, okay? So now I'm going to go over here to my book, and I'm going to look at my dilution, and I see that my patient has 5% dextrose, and I see in my book here, it says that it can be added to D5W, okay? So it's compatible. Rate of administration is supposed to be given over 1 to 2 minutes, and I'm going to do over 2 minutes. Some labs that I would check would be my potassium level. I would monitor my blood pressure frequently throughout this therapy, and I would tell them also to tell me if they start having any kind of adverse reactions or anything like that, to give me a call and let me know, okay? All right. So now that I checked all of that, I know that it's compatible with everything, okay? So now I'm going to get my MAR. And I'm going to check my physician's orders. Check my medicine against my MAR. And I see it here, I have furosemide, 40 milligrams, IV piggyback. Not IV piggyback, IV push. And I see that it's the right dose, the right route, and it's at the right time, okay? All right, so now I've done that. I'm gonna set this off to the side here. All right, so now I'm gonna wash my hands, and I'm gonna prepare my medication, okay? So I'm going to write my patient's name, the drug that I'm given, which is furosemide, and it is going to be 40 milligrams, and I'm gonna put the date. Okay. All right. All right. So I have my label. Okay. Now I wash my hands, put my gloves on. I'm gonna clean my top for 30 seconds. Okay. So supplies. That's how much I'm going to withdraw is for. Because I've done my drug problem already prior. Okay, so. Okay. So. Have my 4 milliliters. And I'm going to label my syringe. Okay. And so now I am done preparing all my medication. And now I'm ready to go to my patient's room. So take off these screws here. Okay. So knock knock. Come in. My name is Amber Jones, and I'm going to be your student nurse today. And today I'm going to be administering your furosemide. Can you please tell me your name and date of birth? And they tell me their name and date of birth, and I'm going to check it right here against their armband right here. All right, so this time I'm going to explain to them that this Lasix is going to help pull fluid off of you, and to please let me know when you have to go to the restroom. So I don't want you to fall or anything like that, okay? All right, so first thing I'm gonna do is I'm gonna wash my hands. And I'm gonna check for allergies. And so I'm gonna ask my patient, do you have any allergies that I need to know about? And I'm looking on my MAR here, and I don't see any allergies. And I'm gonna look at my site to make sure that it's dry and intact. Okay. And now I need to wash my hands, so I need to check for patency. And so I drop it below, and so I drop it down, and I get blood return, so it lets me know that it's patent. Okay, so, all right. Okay. So, all right, now I make sure everything is patent. I'm going to wash my hands, put my gloves on again. Okay, and I've told my patient, I've done their, my teaching, and told them, to let me know, because it can cause the dizziness, and I don't want them to fall. Okay, so now, got my gloves on. Okay, now I am going to scrub my hub for 30 seconds. Okay, so scrub my hub for 30 seconds. So now I'm going to attach my syringe to my port. All right, so now I'm going to give I'm going to give 2 milliliters over, I'm going to give my first 2 milliliters, and then I'm going to wait a minute, okay? So. And start right now, my syringe had got some air in it and it wasn't at 4. So now it's at 4, okay? So now I'm starting off with 4. So now I'm gonna pinch and I'm gonna give my first 2 milliliters. Okay, and then I'm gonna let it flow through for a full minute. And as it's washing on through, I'm asking my patient, how are they feeling? Is there any burning at the site or anything like that? Okay, so now I waited my minute. Now I'm going to clamp again, and I am going to give the rest of my my 2 milliliters. And I'm going to unclamp, and I'm going to let it run. Wait for 1 minute. Okay, and so I've waited my full minute. So now I can disconnect. Okay. All right. So once again, I would ask my patient I would tell them, to let me know if they need to get up to use the restroom, and to let me know if anything, if they have any kind of complications or anything going on. I'm also going to look at my site. I still see that it's dry and intact, okay? And I'll leave my patient in a comfortable position and discard of my supplies. And I'll put this in here. Okay, and after that, I'm gonna leave my patient in a comfortable position, and I'm also going to document how much I gave and the route, the dose, put the time, how my patient tolerated. They didn't have any, and whether or not they had any kind of adverse reactions to anything, and that'll be it.